guys, due to the absence of my client, I will be performing step 3 and 4 of the corrective exercise continuum. Step 3 being activation, which is the stimulation of weak and or underactive muscles and myofascial tissue, and step 4 being integration, which is the re-education of the entire human movement system. So first thing we're going to do is activation, which kind of is based on an isolated strengthening technique, which targets specific muscles through its full range of motion to increase force production as well as intramuscular coordination. And again, this is applied to weak and or underactive muscles. This can be done up to 2 sets of 10 to 15 reps, each rep consisting of a 2-second isometric contraction or an isometric hold, as well as a 4-second eccentric contraction. This can be done 3 to 5 days a week, and that's depending on the intensity and volume. So the first exercise we have is using a resistance band. We're just going to be doing some standing external cables rotations. Alright, and I'm just using a medium, just a standard medium resistance band. So what you're going to do is stand comfortably hip width apart. You're going to flex your arm at the elbow, bringing that elbow nice and tight into the body here, and that's going to be at 90 degrees. And what we're going to do is just fold that arm over, palm facing the torso, tuck that in nice and tight, and we're just going to place the resistance band handle right in the hand. Main thing here is you're going to want to depress the shoulders and somewhat retract those scaps back. What we're going to do here is, from this position, externally rotate to the end range of motion and come back, just like so. So right here, we're going to hold for 2 and bring it back for a 4 count. And again, we're going to perform up to 10 to 15 reps and up to 2 sets of these. And again, we're going to want to contract the core, depress those shoulders, and make sure we can feel those shoulder blades retracting. And this is, again, if I had a client, the trainer can stand behind, making sure that the shoulder blades are being retracted. And again, just a little proprioception, making sure those are nice and depressed. Alright, and the next activation technique we are going to use is a positional isometric technique. This can be done up to, this is going to be done up to 4 reps and 1 set. Each rep is going to consist of different body strength. So the first contraction will be 25% of your body strength, working our way up 25%, 50, 75, and then 100%. What we're going to do here is set up just like we did with our last exercise. So again, flexing at the elbow, bringing it nice and close into the body, making sure you're at a nice 90-degree angle. And we're going to just fold that arm in, again, palm facing the torso. What you're going to do is bring that elbow right aligned with the wall. Here I like to take a little bit of a slight bend in the knee just to give you a little extra stability. And what you're going to do is, again, depress those shoulders and retract. And we're just going to bring our arm right up against that wall. And from here, we're going to isometrically contract. We're pushing against that wall. 25% of our body strength. And then we're just going to bring that back. And again. And this is going to be done on a 4 count. And bringing it in for a 2-second rest. So this will be 75%. Again, making sure that shoulder is nice and depressed. Bringing it in for a 2-second rest. And the 4th rep, 100%. And again, you're going to want to contract that core, depress the shoulder blades, and retract. Alright guys, and our next technique, step 4, is integration. This can be done up to 3 sets of 10 to 15 reps. This is going to be done in a slow and controlled tempo, slow and controlled manner. And this can be done 3 to 5 days a week. So the first exercise we have, again with the resistance band, is going to be a squat. So what we're going to do is stand just as we would for our squat position, so feet hip width apart. We're going to contract the core, depress and retract the shoulder blades, holding the resistance band in our hand. And again, arm is going to be flexed and at 90 degrees. So just like this here. What we're going to do is contract the core, squat down, bringing that hand back, externally rotating, and coming up. Again, I notice myself raising or elevating those shoulders. We want to keep them pressed. Keeping that elbow at 90 degrees. And again, contracting the core, squeezing the glutes, bringing that back. Perfect. And again, this is going to be done 10 to 15 reps, up to 3 sets. Alright, and for the last integration exercise we are going to be doing is a lunge to external rotation. So again, using that resistance band, we're going to set up somewhat like we did last time. So again, we're going to flex at the elbow, bringing that elbow close to the body, and instead of bringing that arm in, we're just going to place the resistance band in the hand, just so your arm is at 90 degrees like so. And what we're going to do with the opposite leg, or contralateral leg, is we're going to take a step forward into a lunge, externally rotating that arm, and back. Thing to remember here, again, contracting that core, squeezing the glutes, but again, we don't want any twisting of the upper body. So when we come down to lunge, bringing that arm out to external rotation, we want to make sure that that left shoulder is nice and neutral, nice and behind. And again with this, when we lunge down, all of our weight is going to be shifting to that front leg, so there should be barely any weight in that back leg. Contracting the core, squeezing the glutes. Making sure that left shoulder is depressed and retracted back. And again, we would repeat this with the opposite shoulder. Those are steps 3 and 4 of the exercise continuum.